the Western world to get cure for certain diseases that seem to be a mystery. Maybe not cure, but I mean proper management for certain diseases that seem to be a mystery. Today, we have joining us to discuss this all important topic that we want to know a lot more about. An American trained physician who currently practices what we call regenerative medicine. I'm talking about Dr. David Ikudayisi. You're welcome to the program, sir.
Thank you, Dr. Kevwe.
Well, stem cell, like I said during my introduction, it's a topic that is not very common around here. And like I was telling you off air, that I'm aware that the government has set up a lab or two and research is ongoing, but in the hospitals, we haven't really seen it in use. But you have already made advances using stem cell to treat different disease conditions. Now, for the benefit of the viewers, what exactly is this stem cell we're talking about?
Okay. Stem cell is part of regenerative medicine. And regenerative medicine itself is a new branch of medicine that aims to restore, the normal body function. Because these things could have been damaged because of age, disease, or congenital, problem. Now, regenerative medicine comprises both stem cells and platelet-rich plasma. Stem cell is any cell in the that can either renew itself or differentiate into any particular specialized cell.
Any cell in the human body.
That is correct. And there are basically three types of stem cells.
Okay.
The embryonic stem cells, which has raised a lot of concern in the medical and general public.
That's these stem cells from very little babies inside
Yes,
the womb, as it were.
that is correct. The cells are derived from anything from 0 to 14 days old, baby, after fertilization. So they are embryos. That is when they are used, 0 to 14 days. Those are referred to as embryonic stem cells, and they can differentiate into anything, both the extra, embryonic and embryonic tissues. The problem is that we cannot currently control how they grow.
Okay.
So it can lead to problem in future because it has to be contained. And there's ethical, concerns, from the public and religious people using embryos.
Okay.
The second type of the three types of stem cell is, I will call it as induced pluripotent stem cells. That's what we refer to as an iPSCs in abbreviation. These are stem cells that have been reprogrammed in the lab to do what embryonic stem cell can do, have the same characteristics, but are less aggressive and less dangerous.
Okay.
Okay. And the third type is adult stem cells. These are stem cells that are, received from a patient, an adult patient, either a baby when it's born from the cord blood, or from an individual's bone marrow, or from the adipose tissue of a person, that is fat.
The fatty tissue.
Yeah, mainly from the belly.
Okay.
These are autologous, taken from a patient, given back to the same patient. So there's no risk of graft versus host rejection.
When you use adult stem cells.
When you use adult stem cells, they are safe.
Okay. Well, I'm sure viewers out there have been like, oh, what kind of grammar is this again? So it will be important for us to take this from what we call a problem-centric point of view. We are discussing a solution, but for viewers to understand out there, we need to come from the problem part of it.
Okay.
So what are some of the disease conditions that have posed challenges that stem cell in terms of regenerative medicine is coming to provide a solution for?
Okay. Currently, there's a very vast list of conditions that we can use adult stem cells for.
Okay.
If you talk of not the reprogrammed stem cell embryonic, but we're talking about adult stem cells.
Adult stem cell.
Which is what I do.
Okay.
So
Yes,
that's what I'm interested in. But apart from cancers, because that's what you cannot just take the cell and use to and apply it for. You have to send the stem cell to the lab, and they're not talking about the programmed stem cells. That's where there's research on how we can use for cancer. But the only two cancers that can use adult stem cells for in animal studies, for example, is the brain cancer and the prostate cancer. It doesn't cure them, it just shrink the size of the prostate cancer or brain cancer. Otherwise, you can't really use it as it is. Take and give by the same day for any cancer. Apart from that, you can use it for diabetics. The stem cells in the body, in the environment with high sugar, differentiate into the pancreas. Pancreas is the organ of the body that produces insulin.
Yeah.
You know, so with time, the patient will be producing more insulin, lowering their dose for diabetics, and then they can survive and live without taking medication for that. Patients that have rheumatoid arthritis, lupus, these are joint problems,
Autoimmune conditions, where the cells fighting
that is
the same body.
What happens is that, you know, the stem cells they modulate the immune system. So that is why anything like Crohn's disease, lupus, rheumatoid arthritis, they work great for them.
Okay.
People with chronic obstructive pulmonary disease, COPD, either because of smoking or because of exposure to chemicals or whatever it is, the stem cell pass through the lungs, they help to repair, regenerate the lung tissues.
Okay.
And then they start getting better. Or there's studies there whereby people are on oxygen. After 3 months, they do not need to wear oxygen through their nose anymore. They can breathe on their own because the lung tissues have been repaired. Currently, right now, in Miami, Florida, there's a research going on for people with congestive heart failure that are expected to be waiting for heart transplants. But there is no need for that with the good results that we're getting down there in the US, because the stem cells are being injected directly to the heart tissue.
You don't say.
Yes. So therefore, people are now able to walk 10 blocks without any problem, getting tired. The injection fraction improves. So for the heart, it's used for the heart attack, the dead tissue in the heart, or the congestive heart failure.
Oh, I see.
And these are being injected directly into the organ. There's also indication for, you know, renal cells to be, you know, repaired. If somebody has diabetes that has damaged their
kidneys,
and then on the way to dialysis, the stem cell, the adult, let me clarify,
stem cell, yeah.
adult stem cells, you know, can help to regenerate those renal cells. First of all, stop the deterioration of the kidney organ, and then with time, help to rebuild some of those renal cells.
And you were talking about nerve tissue.
Oh, yes.
Let's, for example, stroke.
Yes.
Someone who had an ischemic stroke.
Yes, it helps. There are different ways you can use it to do that. Remember we said earlier in the program that stem cells are cells that can differentiate into any mature cells in the body. So stroke, now we're talking about damage to the brain tissue.
Yes.
You know, in the medical world, or we're taught in the medical school, that nerves do not really regenerate. So if somebody has a problem, injury, after like 18 months and they don't recover, then their spinal cord injury or whatever it is.
Yeah, cord transections, you know, and all of that.
It's done. But with what we are seeing from stem cells, that is things of the past.
Well, absolutely amazing and very promising. But viewers and friends out there, I'm a bit sorry. This has sounded a bit academic. But what Dr. David Ikudayisi have been trying to say is that this new aspect of medicine, which has already started, and yet a lot of research still going on, can be used for brain disease, kidney disease, disease of practically any part of the body, except for cancers. A lot of work is still going. So some of those people you know who attempt to have mysterious diseases that do not have cure, the names are so big, you can be sure that the medicine that God has provided for those of us who are Christians and Muslims to come and solve that problem is already here in our shores. Now let's come back to Nigeria, Dr. Ikudayisi. stem cell medicine seems to be doing very well and growing quite fast in the Western world. But here in Nigeria, you are the MD, the medical director and CEO of Glory Wellness and Regenerative Center back here in Ikeja.
Yes.
And I'm sure that you have been up to some work.
That's correct.
So what has been going on with the practice of regenerative medicine here in Nigeria?
Yeah. Here in Nigeria, we've been able to treat patients with adult stem cells. In this case, you can either use the bone marrow or you use the adipose, the fat. We find out that with research is showing that the fat for volume to volume has 500 times more stem cells than the bone marrow. It's easier, less painful on the patient. The patient is awake when we take the fat, the small amount that we need. We've been able to successfully treat patients in Nigeria, either their knee problems, diabetics, high blood pressure, and a patient that had already 2 dialysis before being treated. And after that, patients are feeling better. The only thing I just want the viewers to understand is that whether we are using the platelet-rich plasma, which is using your blood, or we are using adult stem cells, none of this is an overnight cure or whatever you want to call it, treatment result. Is the gradual process. The damage, for example, in diabetes is not done one day, it's over time. So the repair, the restoration back to normal function is going to be over like 3 to 6 months.
So you're not saying they'll go off insulin entirely?
With time, over 6 months, yes, patients are stopping their. Remember, again, the stem cells are, they are differentiating to pancreas, islet cells, producing more insulin. So eventually, when the body is able to produce enough insulin to take care of the daily intake of sugar, there will be no need for the medication that is doing that anymore, because the body can now naturally, the way God designed the body, to do what it's supposed to do.
Oh, absolutely wonderful. That means I'm happy to say cure is around here. But we know how these things are taking in Africa. There's a lot of bottleneck, scientific bottleneck. Take, for example, Dr. Abalaka, the scientist who said he had a cure to AIDS, HIV/AIDS. Now, I don't have the true story, and this is on air, so I cannot talk without having authority, but we are made to understand that he was frustrated out of the system. Now, you are bringing this regenerative medicine that is relatively new around here, though I had rightly mentioned earlier that the government had set up 1 or 2 labs. What are some of the challenges that you have faced thus far?
Yes, one of the common challenges is people understanding and believing how this works. First of all, I want to correct a statement that you made about cure. I'm not promising any cure.
All right.
In medicine,
excellent,
we do not guarantee anything. We only do what we can do, because there are very sure some people who will not react. But if you get 90% of people having positive results,
then you have done very well.
Then I won't call it cure. I think that's a positive treatment. That's the way I will approach it. I let the people decide on whatever they want to call it.
All right, all right.
So now going back to the
challenges here in Nigeria.
Is for people understanding the concept that this is possible, it's been a challenge, because there's no risk of rejection when you transplant the stem cells. There's no infection. And then it's like, are you saying that this can really happen? Just like I said earlier, in medical school, they taught us that nerves do not regenerate. Well, British Olympiad, who was paralyzed, is back swimming 10 laps. Tiger Woods, who everybody knows, is a golf player. In December 2008, he had the platelet-rich plasma therapy for his elbow. The year 2009 was his best, PGA tour year.
Yeah, he's rallying on the tour.
Not only does this platelet-rich plasma or the adult stem cells restore, repair, they help to rejuvenate and even make things stronger. And they have a lot of application. cosmetic, making people look younger. Like these women losing their hair. Sexual function, very great for erectile dysfunction.
Oh, really?
Especially in women too. So it can save marriages. You know, better for urinary incontinence. They don't have to take medication. So all these things are happening. Joint pain, people that can't walk or they have back pain, you can use either the platelet-rich plasma or the adult stem cell or both to help to repair, regenerate all these things.
Well, you showed me pictures of some ulcers off air, and I know that sickle cell disease patients suffer ulcers that seem to be delimers in this part of the world. These ulcers seem to be delimers. You try so much and nothing is happening. But you're making us to understand that, well, stem cells might be a way out.
Stem cells can help, you know, any kind of chronic one. Diabetic ulcers, venous ulcers, arterial, you know, wound, even sickle cells. The body is designed to repair itself.
Okay.
If somebody mistakenly cut their hands or their skin in the kitchen while cooking, over a couple of days, they will, you know, have a healing process going on. It's that same principle that we just know how to apply, accelerate the healing process, make it work faster and more effective. It's the same principle that God has created for human body to heal.
That's what the stem cell is using.
That is what
it's not as if it's some magic or voodoo.
There's no magic, no voodoo. Everything is done in front of the patient, either using the blood or using the fat and giving back to the patient the same day. At least that's why it is allowed in the US for now.
Okay, know. Let's come back to the viewers again, because this show is all about the viewers. And
yes.
Whilst the show is getting most interesting, that's when the producers will usually say we have to stop. But before that time, how expensive or how cheap, talking about cost, and you can be relative in your answer,
okay.
Because in Nigeria now we're in a recession and everybody wants to know, oh, this thing is sounding promising. How expensive or how cheap?
Okay. As far as adult stem cell is concerned, you are doing, whether you do it in Nigeria or you do it in the US or in Europe, you are doing liposuction to harvest the fat, or you are doing bone marrow, you know, drilling to harvest the bone marrow. So the equipment, everything that you are using, they are expensive, especially when anything is new, is expensive, just like medications. Then after about 10-20 years, then the medications become cheaper. So right now they are relatively expensive, especially adult stem cells. The platelet-rich plasma, the blood one, is cheaper. Okay. It's less expensive than that. It's probably going to be more affordable for, you know, middle to this thing. But this treatment is for everybody. But unfortunately, because of the cost of the equipment, even the doctors setting things up, it makes it only limited to certain few clinics.
Certain few clinics at this point in time.
Yes.
But we hope that as time goes on, things should begin to improve, isn't it?
That is correct. And that is where the government can step in to subsidize, set up, you know, and things for the community, whereby patients can get treatment. Because remember, if you can restore, prevent, regenerate a problem, or let's say the diabetic wounds that is not healing, if within 6 weeks, a wound that has not healed for 2 years can heal, you cut down on the cost of the wound care going forward.
Of course.
So that's how the government will have to look at it. You'll be saving money. Yes, it is expensive, but it's going to be cheaper if you look at it on the long run.
On the long run.
How much you'll be spending to maintain that patient when you can stop it now and faster.
And individuals should look at it in that way as well, isn't it?
Yes.
Well, because I know that initially a lot of the money is going to be have to come in out of pocket.
100%.
And then perhaps insurance. Because I was with a health insurance expert on the last episode of the program, and health insurance seems to be growing in leaps and bounds in Nigeria as it were today. Are you looking at partnership with some of these health insurance managers just to be able to make sure that low income or middle income individuals who are the ones that really need this trying to see how you can partner with them?
Yeah, I have no problem with partnering with anybody,
With
whether it's the government,
insurance
health
and,
insurance, or the end point is to take care of the patient. Because the insurance have the power to subsidize, this thing to the co-pay for the patient will be less, and they will cover the back end and cost, So because at the end of the day, we want a healthy country. Health is wealth.
Yes, of course.
We need to climb. If you look at WHO status of Nigeria, it's not that high there. Nigeria can become a medical tourist center with just regenerative medicine. People can be traveling to Nigeria from all over Africa. They don't have to travel to India, Dubai. Nothing against them, sorry. We're talking about Nigeria here. So
not spoiling everybody's business. But I mean, you have to build your own.
Yeah. So I mean, yes, everything's possible.
Well, talking about Nigeria being able to become like a tourist, medical tourist destination, what do we expect 10 years down the line as has to do with regenerative medicine and stem cell use in the cure of diseases here in Nigeria?
Okay. If the resources are there, the support from the government and everything is there, like you mentioned earlier, there are 2 labs already being set up. If the government continue to support them, bring experts from Europe or from America that do things in the line of regenerative medicine, we have more people on board, we can, get Nigeria to where we need to be. We can really, see, the way I believe, what I believe is this: we Nigerians are very smart, whether it's in the medical field or is in the engineering, auto design, or whatever. We're very smart.
Okay.
If we can just have the backup of the financial support we need, we can be the best. Yes, I agree that we are behind the European and American right now in all this research, but put the support there. We've got the brains. Well, Nigeria can take the lead.
So you're expecting that time will come when a lot of hospitals will begin to offer this particular treatment, this particular form of treatment, isn't it?
That is correct.
Now, talking about procedure, what is required? Is this a procedure that goes on in the theater? What happens from when a patient steps into Glory Wellness and Regenerative Center, for example?
Okay. Talking about the procedure, remember I've been trying to talk about 2 main things: platelet-rich plasma and adult stem cell. The easier one is the platelet-rich plasma therapy, which even some universities have done in the past,
Here in Nigeria.
Here in Nigeria, and so it's not really new. And especially platelet-rich plasma is very popular among orthopedics. And little in Nigeria, but a lot over there, because it accelerates the healing power of their surgery. So it makes it as if they don't have a golden hand. All right. And then to do that, you use the patient's blood. You take draw the blood, process it, and then you take the section of the plasma, which is the yellow part of the blood after it has been spun. There's a section of it that is very rich in platelet. That is where the name platelet-rich plasma comes in. That is the golden part that you need to treat any localized problem from head to toe. Now, for the adult stem cells, you can either do the bone marrow harvest, that is drilling the bones to harvest the bone marrow, or you do the fat adipose tissue harvesting, which is liposuction. Well, it's a mini liposuction because patients are not intubated. The patient is awake, we make them comfortable, we take the amount of fat that we need, and then we spend hours processing it.
Using local anesthesia?
Yes, local anesthesia. So no intubation, no nothing. And patients are chatting with you while you are doing that. And you take what you need. And when you're done with the patient can be reading a book because it takes like 3-4 hours to do the processing. Or they can be watching a movie on their iPad or whatever. And when you are done harvesting and isolating the stem cells, you now come and use it how you want it. You can give it as a drip, which is how most of the disease are treated.
Okay.
You can also give it into the joints, instead of
direct intra-articular
injection, or you can give it intrathecal, that is into the spinal cord, in a nice adequate setting, you can also give it into the brain, intracranial.
Oh, I see.
You know, even stroke can be treated that way too, or IV.
Well, it sounds very wonderful. Like it has all been planned out, and we just pray that things go as planned, like you have said, because there are a lot of diseases that people are suffering from, and things have seemed like a mystery for too long here in the part of the world, especially in the sub-Saharan region of Africa. Dr. David Ikudayisi, I want to thank you so much for coming on Lifeline today and simplifying what is supposed to be a supersonic topic. Viewers and friends out there, I'm sure that you've been able to pick a thing or two. There is a new form of medicine in town, and we are hoping that it should help things. It should simplify some of the mysteries that we've had around for quite some time, and we're also hoping that as time goes on, it becomes cheap enough for everybody to be able to afford it. Well, this is the much we can take on this episode of the program. Until we come your way same time next week, ensure to have a very wonderful evening.
Why this couple cannot be joined in holy matrimony, please voice out or forever remain silent. What's the problem?
My little daughter has a present for the couple.
I brought for the bride Swiss flower air freshener. Happy wedlock.
For that nice aroma, think of Swiss Flower Air Freshener. Thinking of a southern air for your customers and friends? Then branded car air freshener is your choice.
For details, contact Stova BV International, makers of Swiss Flower Air Freshener, Oshopi Plaza, 17 Allen Avenue, Ikeja, Lagos.
Distributors wanted nationwide.
Swiss Flower Air Fresheners freshens your world.
The future lay in data. They laid a dedicated fiber optic ring around the country, seamlessly connecting to cities, suburbs, and towns. They created innovative, flexible, and highly affordable data plans. Then, Glo launched 4G LTE. Data so clear and so fast that it will transform the way Nigerians communicate, work, learn, and play. They can listen to millions of music tracks, enjoy thousands of movies, play online video games, and even watch live TV. Their homes have become smart homes. This is the new speed of life.
Enjoy the fastest data speed plus free world-class content at 10 gigabytes for 2,500 naira and 24 gigabytes for 5,000 naira. Available in all Glo.
This is the network service of the NTA.